The healthcare system is in big trouble. It's complex and fragmented. Staff and resources are scarce and coordination is lacking. You've all seen headlines just like this. But real people fall through the cracks and die. Jeff Mendoza was 36 years old when he was admitted to hospital after a suicide attempt. We tell this story with permission from his family, who want to do everything they can to prevent this from happening again. Jeff was discharged from hospital to his single apartment less than a day after he was admitted, wearing only a hospital gown with a prescription for Valium, but no shoes and no money. No one told his family and no one made a handover to community services, and he killed himself shortly afterwards. So lack of coordination in healthcare has real consequences, not only in mental health. A GP, a psychologist, a hospital clinic and an optometrist might all be looking after a person with diabetes, but nobody knows what the others are doing. So how are we going to fix this? The government's approach is to outsource to patients who become responsible for coordinating their own packages of care. This can give individuals more choice, or it can lead them straight back into the maze. It will also be a major fiscal cliff for many disability and community service providers. When they did this in New Zealand, 2/3 of them went to the wall. So doing more of the same is no longer an option. You might not have heard of NetCare, but we have been working on this problem for 10 years and we're now delivering real wins. We've got a software platform designed to take these complexities and make it simple to deliver services across different teams, locations, disciplines and organisations. NetCare's got these qualities. It's scalable from a one provider organisation to millions of people in a region. It's responsive. It works on smartphones for patients, tablets and laptops for professionals and desktops for coordinators. It enables different organisations to work together on the care of individuals, and each organisation gets a brandable website with e-commerce. NetCare grows virally by invitation, and hence it drives our customers' business. NetCare is person-centred. A whole range of services can be coordinated and delivered to the individual where and when they need it. And then we move to shared care, so that individuals can build a care team around them, so that those on the team can share the care with each other. NetCare is smart, interactive and engages people and their healthcare organisations to work together to improve health and well-being. Now, there's a lot of hype in this area, but we have got some real runs on the board. We've done a citywide rollout of our system with Pegasus Health in Christchurch, New Zealand. We've been operating there for 7 years, and our system coordinates 500 GPs, nurses, community care services and support services, right down to patient transport, all linked up by a platform. Over 80,000 episodes of care have been delivered to patients. And here is the good news. In the first year of operations, Pegasus reported that presentations to the Christchurch Hospital Emergency Department fell by 6%. I will just repeat that, fell by 6%. Ask anybody who works in a major hospital or for a state health department what that would mean in Australia. Pegasus were really happy with us and kept us on. So for the next 6 years, the system ran with one help desk call a year to us. And last year we won a competitive tender for a major upgrade, which we finished a month ago. More recently, we were selected by the largest residential care provider in the Southern Hemisphere, HHL, from an international field of over 60 applicants to supply our system to a joint venture into China for 100 super clinics. We did a successful feasibility test in China in December, and we're going back soon to implement the first live site. We have some traction in the Australian market too. Here are customers, which include aged care, general practice, mental health and allied health services. We've got several thousand patients registered on the system in Australia, but we are bigger overseas than we are in Australia. However, we're getting ready for a major push here. And here are our research partners. With Victoria University, we're developing a new model for securely sharing health information. With the University of Adelaide, we're researching better chronic disease management in general practice, and with USQ, we're looking at online mental health assessments. Now, because our platform is about coordination across different services, we can and have entered different market segments. So I'll pick out two here that I haven't mentioned before. We're implementing NetCare for pastoral care coordination and have started a proof of concept with several pastors and churches. And we're developing NetCare into a full practice management and clinical software solution, hence entering that sector as well. So we've got a very experienced team. Frank is another serial entrepreneur. He's our CEO and also the systems designer of NetCare. I'm the clinical director and, as David said, GP and psychologist, but I have significant expertise in large-scale health system reform and development. Tracy Siebert is GP NetCare director, has a nursing background and major experience in health systems management, policy, service development, quality and safety. Rian Landman is another serial entrepreneur on our team. He owns a group of general practices and is driving the clinical software development. Inoki Viamatahua is taking our system into the pastoral care market. He's off to the US next week. And Innovise Medica is, of course, on our team. And they provide boundless energy and expertise in organisational growth, strategy and marketing. So what difference can NetCare make to people's lives? So here's Bill, 68, with heart disease. He's got a GP, a physiotherapist, a counsellor and a cardiologist looking after him. With NetCare, they're all on the same page about his medications and care plan. Bill can see his own plan and ask a family member or carer to be on his team as well. He gets reminders and health promotion messages directed particularly for him. He can take his blood pressure at home and have that go into the NetCare platform. In a nutshell, Bill gets the care he needs to stay well in the community. We also help doctors, nurses and allied health professionals deliver better care with greater efficiency and receive more income. On Monday this week, we started a trial with the Playford Uni Health Super Clinic in Adelaide, and we have several other general practices waiting to join. So we work with healthcare organisations in Australia and around the world to grow, prosper and meet their vision of high quality care where and when people need it. Helping people stay at home and out of hospital makes the healthcare system sustainable and affordable. So, as you can see, we're not a startup. We've got great clients, some compelling results and revenue that's taken us past break even. We're working with Innovise to move this into large-scale growth. And we're here looking for partnership opportunities or contacts who can help us go forward. We can demonstrate the system live and we can answer all your questions. Come and see us to arrange a meeting. Thank you very much.